Hi, I'm Dr. James Bissland. Welcome to Health and Information. This is the information program for chiropractic patients, their family, and friends. Our focus on this program is to help to give people a better understanding of what chiropractic does, what we as chiropractors do, and what you can expect in a chiropractic office. Today's program is going to be focused on chiropractic miracles. And in today's program, we have stories from some of the top chiropractors in the United States about conditions that they've seen in their office that they consider to be miracles. When we talk about miracles in chiropractic, we're talking about people who have responded to things that they didn't respond to in any other method. Medicine didn't work. Surgery may or may not have worked. Even physical therapy doesn't work. Why does chiropractic work? Because chiropractors get to the root of the problem, the cause of the problem. One of our leaders in chiropractic that many of us had worked with for years, used to say that the DC, Doctor of Chiropractic, also stood for the Doctor of Causes. We find the cause and get rid of it, and that helps to get the symptoms corrected. But when we fix the cause of the symptoms, the chances are they're not going to come back. We have a little thing here that we use in our clinic called the block talk, and we have these little blocks, kind of like kids used to have when they were little. And the block talk tells us how things work. And it all starts with this one, the pinched nerve. The pinched nerve is what determines whether or not we have a chiropractic patient versus a medical patient or a surgical patient. Now, if the pinched nerve is let go, then we have lower tissue resistance. That means the tissue is not getting its normal nerve supply or therefore its normal blood supply, and the resistance of that tissue to injury or symptomatology increases. Following that, then we have dysfunction. Dysfunction is when that tissue, body, organ is not working the way it should. It's like our lights here in the studio. If the electricity doesn't go to the lights, they don't come on. They malfunction. But let's say the electricity is halfway there or halfway on. They're going to be on, but the lights are going to be on about half of what they are supposed to be. That's dysfunction. Finally, we go to symptoms. And this is where most people see us for the first time. They have symptoms. And if we let the symptoms go, we even get worse. We have severe pain and degeneration. These two here are where we see most of our patients. We begin to treat them and we get back to here. They're feeling better. Lower tissue resistance is still there. The pinched nerve is still there, but the patient feels better. This is where a lot of people who quit chiropractic care stop. The problem is that they haven't fixed the problem. They haven't fixed the cause. The dysfunction returns. The symptoms return. About this point, and some people, and we get to the severe symptoms on the others, they'll come back and we'll go through that symptoms again. And we'll treat again until we get back here. No pain, no symptoms. Unless we get to the root of the problem, the pinched nerve, get that corrected, we're not going to have these disappear and stay gone. This is the premise of chiropractic as it was discovered back in 1895 by Dr. D.D. Palmer. Dr. Palmer did very unscientific first chiropractic adjustment, but it began a long journey of science and education and research that helped prove the science and art of chiropractic that we all now use in our clinics every day. We call our profession the art, science, and philosophy of chiropractic. The art is the ability to adjust the spine, to manually manipulate the spine, to correct the pinched nerves, called subluxations. The science, the research that goes into what we do. The study between the time we see the patient and give them the report of findings. We study their case, use scientific protocols in order to achieve a treatment plan, and then we apply the art of chiropractic to get the problem corrected. Chiropractic miracles, they happen every day. We have them in our offices every day. All of us do. We're going to talk first with a chiropractor who has had some real great things happening in his practice. He's going to talk to us first here about neck pain and a case that he saw in his office. This is Dr. Jim Silva from San Antonio, Texas.
I'm Dr. Silva from San Antonio, Texas, and I'd like to talk to you about one of my patients named Arnulfo. I won't give any last names. Arnulfo comes to me with neck pain. Well, Arnulfo has several of his cervical spine fused. He has had high blood pressure for several years. I started treating Arnulfo primarily in his upper neck, and his symptoms got better. And one amazing thing really happened that was so amazing was that his blood pressure had decreased. It decreased and normalized so much that when he went back to his medical doctor, his medical doctor says, Arnulfo, after 4 years we finally got your blood pressure medicine to finally work. At which time Arnulfo said, no, I've been to a chiropractor for 2 weeks. 2 weeks. And now the blood pressure is normalized. His medical doctor gave me a call and wanted to know what it was that I was doing to him. And I told her that I was just adjusting his upper cervicals, and as a result his blood pressure had normalized. And the medical doctor said, thank you, keep up the good work. Anyway, I like to just report that patient's blood pressure is normalized. Chiropractic is amazing, which you probably already know. If you're around San Antonio, Texas, and you need to come see us at Silva Chiropractic, here we are. Have a great day, and talk to you later. Bye-bye.
Thank you, Dr. Silva. That information is so valuable, and I think that as we go through these doctors who tell their stories here on our program today, that you're going to see that there's a wide variety of things that chiropractors can treat. Our next guest is Dr. Darcy Stotts from San Angelo, Texas. And Dr. Stotts is going to talk to us about a very interesting case she had about head pain and headaches. So, Dr. Stotts?
Hi, I'm Dr. Darcy Stotts, and I'm from San Angelo, Texas. We've seen quite a few miracles in our office, too. We've been very blessed for that. Chiropractic just is prone to have miracles. One of the miracles that just comes to mind right off has been a recent patient that's been visiting our clinic. He complained of head pain so severe that he was very limited in his activities and felt so badly that work was almost impossible for him. When he extended his head, he had massive pain up here on the side. He had 2 head traumas. He had a baseball hit him, and he also had a car accident. This type of pain is not unusual for car accident victims. So the first thing that we did was look at his spine at the very, very top, and we checked the alignment, and we checked the pressure on the nervous system, and come to find out at the very top of his spine he had a terrible misalignment at the first and second vertebra. We adjusted that patient with a very gentle instrument adjustment, and that patient's response within 24 hours was tremendous. He was almost 75% pain-free, and his function has gradually increased, and his ability to work is different. His wife said she's gotten her husband back for the first time in, I think it's 11 years, so he has been very pleased. And one thing that's cool about this patient is every time he comes in, we adjust him and he still improves. And so you would think once the pain is gone that this patient would be pretty much ending his care plan, but that's just the beginning. He's starting to gain function and strength and stability, and so that's our long-term goal with this patient. So we're very happy to talk to you about that miracle for today. Thank you.
Thank you, Darcy. That was great, and I really hope that everybody, when you're listening to each of these doctors that we're bringing on today to talk about these cases, you're getting an idea that chiropractors can do a lot of different things. All of you have family and friends and neighbors and people, co-workers, people you meet who have a lot of varying conditions and varying symptoms. A lot of them are suffering needlessly. Our next story is really going to tell you a little more about a very interesting but strange case that was seen. I'd like to introduce to you, this is Dr. Rita Goldman from Maysville, Kentucky. And Dr. Goldman is going to talk to us about a case called torticollis that she had in her office. This is an interview with Dr. Goldman that I did in San Francisco last fall. Okay, now our next story talks about a miracle that happened with a chiropractic patient. This particular patient had something called torticollis or wry neck, and I'd like to introduce you to our colleague, Dr. Rita Goldman from Maysville, Kentucky. And Dr. Rita is the one who saw this miracle happen in her office. And Rita, thanks for joining us.
Well, I'm delighted to be here with you all today. This patient came to me recently, and she had for 2.5 years her neck turned to the right so badly that she had to hold it up. So she would go around all day like this. She couldn't sleep normally in a bed. As a matter of fact, she couldn't even get more than about 2 hours sleep at a time at the most. And she had been to every kind of doctor imaginable. Nobody knew really what to do with her. She'd been put on every kind of muscle relaxers, and she'd even been told that this was a problem that wasn't physical, it was a mental problem that she had. So she didn't know where to go. She was referred into our office and came in really about 3 or 4 months after she'd been referred because she had so much apprehension. She'd been to other chiropractors, and the other chiropractors wouldn't even touch her. When she came into us, we really knew exactly what to do with her. In our office, we have been blessed to help many unusual cases, and I'd had several cases like this. I'd had a little girl in 2 weeks before that was only 7 years old, and she had just responded beautifully. So we started the same treatment with this lovely lady, and now after 5 visits, she can turn her head back to the left, all right, and can hold it forward, and she's no longer having to support it. It isn't to the center line all the time, but there is such a drastic improvement that she looks like a different person. So this has been a wonderful miracle in her life. She comes in and she has cried with me. She's been so overjoyed with her results. So if you have someone that's got wry neck or a spasmodic torticollis, that's what this was really diagnosed as, send them to a chiropractor.
Thank you, Rita. Now, this program is, you all know, is internet-based, so we don't know where everybody's going to see it. But we understand that you and your husband, Dr. Arnold Goldman, have a radio show.
Yes, we do.
And when is it on?
We're on Wednesday mornings from 10 to 10:30 on 99.5 out of Georgetown, Ohio. It's WAOL.
Okay. So maybe they have a website that has an audio feed and people can listen to you worldwide.
Tune in to us because we really have a great time, and the program is called With the Goldmans.
And you do let Arnold talk, right?
Not very much.
No. That's what I thought.
David's on with me now, my son, okay? And he's taken over. It's more like, does he let me talk?
I can't believe that one. Rita, thank you for being here. Appreciate it.
It's been a pleasure.
Thank you, Rita. Tell you what, that woman, she's got some energy. In just a minute, you're going to meet Dr. Rita's son, David Goldman, who works with them both in their Maysville clinic and in Georgetown, Kentucky. The next topic that we're going to discuss is more of a common chiropractic topic. However, for those people who have it, who were able to get the problem corrected on, they will tell you it's a miracle, and that is sciatica. I have two doctors, or two people who are going to talk about sciatica. The first one is Dr. Rita Goldman's son, David Goldman, and he's got an interesting story to tell you. We're going to follow that up with Dr. Joe Virno from Arlington, Texas. So we're going to run these two back to back. First will be David Goldman, and then Dr. Joe Virno.
Hi, I'm David Goldman with Maysville and Georgetown Family Chiropractic. I've grown up in chiropractic my whole life. My grandfather was a chiropractor, my mother was a chiropractor, my father was a chiropractor, and I happen to be in the position to help them run their clinics. Now, while I've been with Maysville and Georgetown Family Chiropractic, I've seen a lot of miracles happen, if you would, but they're not miracles, because to us, it's what we see every day, and it's treating people that are ready to feel better and ready to be healed, because a lot of times we're one of the last people they've talked to. One of the biggest things I've seen in our clinic is sciatica. Now, what sciatica is where there's pressure on the nerve, and this nerve goes all the way down to your leg. You know, I remember this patient coming in saying, "I've got such bad pain in my big toe." And we're like, well, it's probably due, you know, to some pressure on your back, some disc herniation, what have you. Well, once the patient was receiving some decompression therapy in our clinic, he was amazed with the relief. He was having problems even with his inner thigh and his growing area where it was pulling on it. His low back was hurting it. And to see him after about 10, 15 treatments have such a progression, he was running again, he was active, he was playing basketball, he was able to enjoy his life and not have to worry about the constant pain. That was a miracle, because I think the biggest thing is that we keep people on track with their lives and allow them to go every day and enjoy themselves. So chiropractic holds an amazing amount of different things for you, whether it's sciatica, carpal tunnel. We treat it all. Just ask your chiropractor today. That's what I do.
I've treated thousands of men and women that have had sciatica, and as James just explained, it's a sharp lower back pain that will extend, radiate down through one buttocks area and down the back of the leg and all the way to the foot. The patient I'm thinking about is Ray, and Ray had lower back pain for many years, and he elected to have surgery, and he had a laminectomy done on his lower back, and it seemed to help him, and he's a golfer, and however, the lower back and leg pain returned even though he had the surgery. It's been my experience that over half the time, surgeries initially will give you good symptomatic relief, but with the passage of time, the symptoms do return. So Ray's a golfer, and he's also a widow, and one of his big things is playing golf, as I said earlier, and he wanted to get back on the golf course and enjoy his retirement. Ray is a financial type consultant. He's retired, but they still retain him because he has so much knowledge and can still help the company, and he sits on the board with the monthly board meetings to help the company continue its success. So on examination, if I would raise up his right leg, you should be able to raise it all the way up with the sole of the shoe pointing toward the ceiling of the room. Well, in Ray's case, we could only pull his right leg up approximately 30 to 40 degrees. Normal is 50 degrees. And he had really a hot lower back. When I would palpate it, it'd be very, very tender. And we did the test called Valsalva, and which determined that his disc in his lower back again was flaring up. So as a result, and he also had a short leg and a restricted range of motion, and he had many sleepless nights waking up in pain when he would roll over in bed. So upon examination, I realized he was having severe pain and was very unstable in his lower back structure. So we walked him across the hall, and we took a couple x-rays of his back, one from the front, one from the side, and we could see where he had had his surgery, and we could also see where he was having the disc wedging. Normally the disc should be flat, we'll say like a donut, but his case, he had disc wedging, which is similar to like a doorstop for a door. So after analyzing the x-rays for an hour and having him sitting with therapy for a while, we then had him come back, and after I'm a Gonstead chiropractor, so I analyzed the x-rays using the Gonstead methodology, which I've had great success with that system, and I determined he needed to be adjusted. And Ray underwent a treatment protocol of approximately 20 treatments. He did not want to have any further surgery, because after you go through a surgery, you really don't want another surgery, because there's a lot of things that will come up and then you realize it was unsuccessful, and he did not want surgery. So we proceeded to adjust him side posture, where we have him laying inside, and I contacted his L5 spinous and adjusted him using the Gonstead technique. And after the first adjustment, he felt some relief. We also used decompression. I have the DRX 9000 decompression table, which is the #1 table in the world, and that reduced the size of his swollen disc, and it rehydrated it, made it taller, opened up the nerve hole, and we also used a couple more therapies to decrease pain and swelling. And as a result of that, after going through about 20 treatments, he was totally pain-free, and he's been back playing golf now for a couple years at least, and he's very, very happy and very sold on chiropractic. So happy he's written me testimonials that I've been able to use for other patients to read, and also he puts them on the internet for me. Thank you, James, for having me here today.
Thank you, David and Dr. Virno. These insights are very interesting and I think very informative. I'm going to step in here a little bit for a minute between this segment and the next one, because when I first started in practice in Titusville, Florida, there was a little incident that we had that happened that relates to the sciatica that we just talked about. But this even goes a little further. My father, who was also a chiropractor, used to love to go to the hospital surplus auctions. And he would bring home some stuff. Sometimes it was for the office, sometimes it was just for the house, or sometimes it was for somebody that he knew that needed it. But he came home this one particular night after the auction with an old, ugly hospital stretcher. And I said to him, "What are we going to do with this?" He said, "I don't know. But I just saw it and thought it would be something that we might ought to have." All right. That was just okay. I didn't know what we were going to do with it. Well, the next morning I found out. Telephone rings and a lady called and she says, "Dr. Bissland, my husband is having severe low back pain down his right leg, can't hardly move. He's stuck in his truck. He can drive, but he can't get out of the truck." And I said, "Well, maybe, if it's that bad and he can't get out of the truck, maybe you ought to have him go to the hospital and they can check him out." She said, "He won't go." He said, "He's going to come. He's on his way to your office right now." And I said, "Okay, I'll see what we can do." So I picked up the phone. Dad was still at home. I picked up the phone and I called him and I said, you know that stretcher that you got at the auction last night? He said, yeah. I said, would you throw it in your van and get it here because we're going to need it. So he did. Guy pulls in his little truck and he can't get out of the truck. He is stuck in the truck. So we pulled the stretcher over and lowered it down to the level of it and laid the truck seat back. Fortunately, it was a king cab, so there was some room for us to work. And we were very slowly able to pull him out of the truck onto the stretcher, wheeled him into the office, and began some treatment on him. Now, after we finally got him to where he could stand, we did the typical exams at x-rays and found out that he had a disc that slipped that's pinched the sciatic nerve, and it pinched it so hard he couldn't move his leg or, of course, put any weight on it. We did begin treating him for a while afterward, and about 4 months later, he was not only able to walk and function, but he had absolutely no pain from that. And he's a plumber, so he really did a lot of physical work and crawling under sinks and under foundations and under houses and so forth. And so that probably would be the biggest miracle that I've seen in my office in 25 years or more of practice. Internal conditions, people don't look at those as being chiropractic cases, but as I talked about in the very beginning of our program, a lot of times we're going to see a pinched nerve that's going to cause the tissue resistance to be reduced and then the dysfunction. That doesn't mean just of the muscles and the nerves and the tendons and ligaments and so forth. That means to every part of your body, every organ, every tissue, every cell. If the nerve is pinched that goes to your stomach isn't going to get normal nerve supply, therefore it's not going to function normally. They say that it takes the weight of a nickel, the force that the weight of a nickel would produce onto a nerve, that will cut that nerve function by 50%. That's not a lot of weight. So when the nerve is pinched to the internal organs, it can cause a problem. I have 2 doctors that spoke to us about internal organs. One of them has been a almost lifelong friend of mine, Dr. Mara Pinnell. She's from Independence, Missouri. And the second one is a return of one of our previous speakers, Dr. Jim Silva from San Antonio, Texas. They both have stories about internal organ conditions, internal conditions that they've treated successfully in their practices. So we're going to see Dr. Mara Pinnell first, then Dr. Jim Silva.
Hi, I'm Dr. Mara Pinnell, and I practiced both in Missouri and California over the years of my practice. I've been in practice since 1986. And I've been asked to speak to you a little bit about what I see as the miracles in chiropractic in my office and in my practice over those years. Currently, I'm retired. I'm a full-time minister, so miracles are also in my repertoire now, as far as that goes. But, throughout my life, and I come from a chiropractic family, I have seen so many people be helped through chiropractic when they were not helped anyplace else. And that's not because there's something wrong with other forms of treatment, but it's because when people have a chiropractic problem, they need chiropractic care. You wouldn't go to a foot doctor for your teeth, and so if you have a chiropractic problem, it's important to see a chiropractor. Throughout my years of practice, I have seen many things that many people would call a miracle. But one particular thing comes to mind at this moment, and that is that we had a neighbor that was a neighbor of my parents, and he was a lovely man, and I knew him for many, many years. And he came to me as a patient, rather as a last resort, because he had for about a year and a half before I saw him begun to have a problem with his digestive tract. And at first it was just kind of minor and inconveniencing, but he basically had a lot of diarrhea, and it got to a point where anything he ate went straight through him. And they had done every imaginable test. They had scoped him up and down. They had done all kinds of imaging and biopsies and everything you might imagine. And the doctors, frankly, could not figure out what was wrong with him. So he came to me as a last resort, and he said, I don't know if you can do anything for me, but they've told me that if this continues, I probably am not going to be around in 6 months. And I said, well, Chet, we don't want to do that, so let's see what we can do. And I took a look at him, and the first thing I noticed was that he absolutely had no range of motion in his back. When he moved, he was kind of, like this. Nothing was moving. There was no mobility. We did some x-rays and took a look at his spine, and he had horrific calcifications at every level of his back. Well, I knew that we weren't going to be able to do some major adjusting and manipulation on him, so we started very gently. We used a little tool that chiropractors call an activator that's a spring-loaded mechanism, and what it does is it allows us to specifically contact on the joint and get some motion in there without putting a lot of stress on the body. So I started with that with him. Now, mind you, he had not been able to hold down solid food for 6 months when I started. Within 1 week, the diarrhea had completely stopped, and all we did was start to work with getting mobility to his spine. And here's the reason, and here's the problem that he was having. He had so much nerve interference at so many levels that his body was shutting down. It wasn't working correctly. We have a brain, and that brain directs everything that takes place in our body because it is an extension of that. We have the spinal cord and all of the nerves. And when there's interference to that, it's like getting a kink in your garden hose. You can't get water to your garden if the hose is kinked. He had so many kinks that his body wasn't getting enough nerve energy, enough vital force in his body to get there. Now, I'm happy to report that Chet responded very, very well. In fact, I was surprised even at the amount of range of motion we were able to get back into his spine. And the best news of all is that Chet lived another 20 years after that treatment and never, ever had that problem again. However, what I also know is he continued to get the chiropractic care, both at my office and then with my sister, who also practices in Independence. Now, that looks like a miracle. What's really the miracle is the human body. And when you take away the interference to the human body, and it begins to act and work the way it was designed to, it's a self-healing mechanism. And that's what we really do. That's what my job has always been, to remove the interference and allow the body to heal itself the way God intended. Anyway, I thank you for the ability to share my story with you today. And see you later. Sure. Bye.
We have this woman that I had as a patient who couldn't get pregnant. She and her husband had been married for approximately 16 years. And the only different thing that she did in her life was come see us at Silva Chiropractic. They're in San Antonio, Texas. And inside of 5 months, voila, the 2 cysts that she had on her left ovary had just dissipated, just disappeared. Well, she went back to her gynecologist and OBGYN, who was so excited to let her know, oh, and by the way, you're also pregnant. So that's one of our stories that we like to express and tell. And that was just a matter of a few months ago.
Thank you, Dr. Pinnell and Dr. Silva. As we move along here, we're going to go to a couple of topics that are not necessarily directly associated with chiropractic, but in fact are very valid because results speak for themselves. Our next topic that we're going to talk about is the treatment of addictions and compulsive disorders. Back in the mid-90s, my father decided to expand his knowledge of healthcare, and he got involved in the Certified Addiction Professional certification program and taught a lot of the rest of us in our family, as well as our staffs, how we go about helping people who have addictions and compulsive disorders. Now, in our Health and Information series, we're going to develop a complete half-hour program on that one topic by itself at some point down the road. But today we have a doctor who has had some experience since she started and implemented the addictions and compulsive disorders in her practice. I'd like to introduce to you from Bay City, Texas, Dr. Kathy Cook.
Yes, we've implemented a new service in our office. It's new to us. It's auriculotherapy. It's non-needle Chinese medicine. And we have started addiction programs. And one of my patients came to me because she smoked over 2 packs of cigarettes a day and has done so for over 20 years. Well, she had a great incentive to quit smoking because she had a new grandson, and her son would not let her hold the baby because she smelled like tobacco and smoke. So she had a great incentive to quit smoking, but could not quit smoking on her own. So we implemented the auriculotherapy for addiction with her, and she is smoke-free today. So we're very pleased about that.
Oh, she's been smoking 2 packs of cigarettes a day for 20 years. And how long did it take you to get her where she's now not smoking any?
It took less than 3 months. She also worked in an environment. She drove a forklift. So the employees had a routine. On breaks, they would drink coffee and go outside and smoke cigarettes. So there was a routine that she had to work around, and her coworkers, and put up with a lot of peer pressure, but just done real well with it.
Fantastic. Okay, would you consider that to be a big miracle in your office?
Yes, I would.
Thank you very much. Appreciate it.
Thank you.
Thank you, Dr. Cook. If anybody has a problem with either an addiction, compulsive disorder, ADD, ADHD, contact one of the chiropractors and on our program today. And by the way, all of their contact information will be available at the end of the program on the credits, so you can get that information from them and be able to get you the help that if you have a desire and or need for that. Our next speaker is going to talk about a very serious patient condition that he saw, and that he had a patient in a wheelchair that was able to get some great results through chiropractic. And I'd like to introduce to you from Cincinnati, Ohio, Dr. Randy Fick.
Well, we treat a lot of difficult cases, and this is a case where a lady came in our office who was in a wheelchair. She could actually stand, but only for a brief moment, in order to transfer herself from the wheelchair to a table. She actually could not walk at all. The lady had a chronic lower back condition. She also had stenosis and quite a bit of scar tissue from 2 back surgeries. So over a period of time, the scar tissue has led to a mechanical dysfunction as well as neurological dysfunction. So her inability to walk and her inability to ambulate came from neurological weakness in her legs, but also mechanical weakness in the fact that the lower back could not get itself into a proper position to ambulate. So what we did is we realized that the stenosis and the scar tissue was really bad, and we started her on a treatment of shockwave, which is a type of therapy similar to ultrasound. However, it's about 8 times stronger. So we ran that along her rectus spinae, and over a period of about 4 weeks, she began to use a walker. We continue to do chiropractic treatment on her in order to get the stenosis and the motion in the lower back going. And after about 4 weeks, she started using a cane. And the more chiropractic and the more shockwave we did, the better she began to move, and the more her legs have become useful to her. After about 8 weeks, she got rid of her cane, and then she has been walking without a cane and without a walker. and you certainly can feel the lower back and feel that the scar tissue is much more flexible. You can feel that the back is more functional. Now she does continue to get supportive chiropractic care, but in her own words, I only have to come in about once every 8 weeks in order to prevent myself from deteriorating back toward the wheelchair. So about 6 visits a year keeps her out of the wheelchair, and she certainly is much happier and healthier, and is doing quite a few things now. So that's my chiropractic miracle. We do see miracles every day in the office.
Thank you, Randy. That story really is an inspiration when I hear it, and so many of these stories that we hear from our colleagues all over the country when we get together for meetings, we talk about patients and the results we get and the miracles that we see every day. And I don't know, I can't speak for everybody, but for me, the amount of miracles that I hear about and see on a daily basis are really motivating, especially when you've been in practice more than 25 years, you're doing the same thing, knowing that what you're doing is benefiting people in such a dramatic way. And then when we see the different miracles that happen, it really does make a big difference in our motivation to be able to go out and do the same thing every day, day in and day out, to be able to see more and more people get better health, better function, and be able to have a more healthy and enjoyable life because of what we do. And for me, that's a very big motivator. Our next topic is a very serious one, especially for those people that have, and that's migraine headaches. Migraine headaches can be very debilitating. They're very epidemic. Many millions of people suffer with migraine headaches, and we are able to get results in a lot of those cases. Remember earlier in the program where I talked about the cause. We're looking for the cause of the problem to determine whether or not your case is one that we can accept based upon the science, evaluation, examination, and determination as to whether or not your headache would be caused by a chiropractic causation. Our next two doctors are going to talk about 2 migraine cases that they had that were pretty dramatic in their office. Our first doctor is Dr. Bruce Weiland from Whittier, California, and then Dr. Bruce Holmes from Burbank, California, are going to tell us about cases that they each had in their offices on migraine headaches.
Okay, so, Dr. Bissland asked me to talk about this particular miracle, but I want to take a step back. Next year, I start my 33rd year in chiropractic practice in January. I am a chiropractor today because as a pre-dental student at Cal Poly in San Luis Obispo, after getting out of the military, I began to have hand problems and almost could not use my hands anymore. If it wasn't for chiropractic, I wouldn't be here today. So that's why I'm a chiropractor. We see miracles on a daily basis, and it's almost impossible to remember all of them. But just as an example, I had a woman who came to me. She had a 25-year history of migraine headaches. She'd gotten so bad that they were now hospitalizing her every year and putting her in a coma, a medically induced coma, for a week to 2 weeks. And that had been going on for several years now. She was on the last medication they thought they could put her on. The concern was because of the control of the migraines, they kept having to raise the level of medication, and the toxic effects could kill her. So she came to me hoping to get off of this care. Now, this was back in the late 80s. She had no insurance. She had to pay out of her pocket. I saw her about 180 visits in just under 2 years. But after the first 100 visits, she was off all medication. At 180, she was having no headaches. Not no migraines, no headaches. 3 years later in follow-up, she still had not had a single headache. The question is, how many visits would it have taken if I'd seen her 25 years earlier? Now, can we help all migraines? Only if they're being caused by something that we work with. You've got a tumor in your brain? Obviously not. That's why we do exams. That's why we do x-rays. So we know that what you have is something that's likely to respond to what we do. So if you've been suffering with migraines and have not been able to get assistance, you need to get yourself to a really good chiropractor. Thanks for listening.
Okay, thank you. Appreciate it, Bruce. One of the more compelling case histories of a patient that I've treated pertains to a lady whose name was Laurel G. Laurel came to me as a referral from another patient who, as she came in said, Mrs. P said that if you couldn't fix me, nobody could fix me. I was somewhat flattered and somewhat alarmed by such a proclamation, but at any rate, she proceeded to say that she had had a migraine headache every day for the last 5 years, and if I wasn't able to fix it, then she knew exactly how she was going to fix it herself, and she proceeded to pull a silver revolver out of her purse. So I figured that she was serious about the severity of her migraine headaches. And she had told me that the doctors that she had seen previously had told her that her migraine headaches were unresolvable because they were a result of degenerative changes in her cervical spine. So I examined her, took some x-rays of her neck, and proceeded to tell her that the good news was that I was going to be able to help her. The bad news was that she didn't have significant degenerative changes in her spine. And she was rather surprised by that because she had been led to believe that the degenerative changes in her spine were the cause of her headaches. She said that she was in bed with a bad headache for 3 to 4 hours every day. She stated that it had ruined 5 years of her life, her husband's life, and her kids' lives, and that something needed to be done, otherwise she wasn't going to be able to continue to live. So after about 6 weeks of treatment, she was now headache-free for the first time in 5 years. At that point, she brought her gun in again and stated that if only she had known that 6 weeks of treatment would bring her to the point where she wasn't having headaches every day, then she would have done something much sooner, but she had been led to believe that nothing could be done for her headaches. The reason that she brought her gun in was because she wanted to go kill the doctors that had told her that nothing could be done when obviously only 6 weeks of treatment was necessary to get her to a point of having her headaches resolve. I assured her that her underlying problem wasn't fully resolved, and I didn't do any visits to the local jail if she went and tried to create some kind of mayhem with the doctors that had treated her previously. Overall, it took about another 8 months of treatment to get her to the point where she was stable and improved to the point where she was headache-free. She's now been headache-free for approximately 15 years, and she's lived a happy life without her silver revolver since then. Thanks.
Thank you, Dr. Weiland and Dr. Holmes. As we're going through all of these stories that we're hearing today about chiropractic miracles, the one thing that keeps coming to my mind is, wow, these people's lives are changing and they're improving. And the doctors in all the clinics around the country are making these things happen. Another condition that really is becoming more and more of a problem around, especially workplaces, is carpal tunnel syndrome. Now, in my practice, we treat a lot of people with wrist and hand pain, carpal tunnel syndrome. But the gentleman I'm going to have talk about that now is probably the most experienced chiropractor in treating carpal tunnel that I personally know. So from Arlington, Texas, I'd like to once again welcome Dr. Joe Virno.
My name is Dr. Joe Virno, and I practice in Arlington, Texas. And I have treated thousands of people that have carpal tunnel, and I've treated them non-surgically. And basically, when they come in my office, they normally will have numbness or tingling in their first 3 fingers, their thumb, their second, and their third digit. And then they will usually have swelling in the forearms, and then they could have radicular pain going up the arm. Then the other scenario with carpal tunnel is sometimes the pain will go actually from the neck down the arm into the forearm, and then the 3 same fingers are numb or loss of feeling or tingling again. And if they have a both in the hand and both and in the neck, they call that double crush. So it can happen at either end. I've found that most of the time it happens in the forearm hand. So the patient I'm going to tell you about, I just happened to see last week, and he's a CPA, and he's been suffering for approximately 6 months in his right arm and hand, and he uses a mouse a lot on the computer, and he has so much discomfort he cannot use the mouse. And so I examined him, and I looked at both of his forearms, and the complaint side is his right forearm, and I had him turn both of his forearms up, and I compared the right to the left, and I explained to him that his right forearm is twice as large as his left. And then he wanted to know if I could help him or not, and I explained to him I've treated thousands of people that have carpal tunnel, and he had already visited one chiropractic office that thought the problem was in the neck and received 5 treatments with no improvement. But I felt like the problem was basically in the forearm and hand. And the treatment protocol I used for him was to reduce the swelling in his right forearm, and there's about 3 different therapies we can use for this: ultrasound, Therastim, and the shockwave. And in his case, we used the shockwave therapy, and after this first treatment, the right forearm that was swollen, the swelling had reduced by 50%, and he was quite frankly amazed. And then I also adjusted his wrist. That was just the only 2 things that we did, and I imagine I'll probably see him about 5 times, and then his symptoms should be gone and his problem corrected. But basically he has tendonitis in his forearm, and his forearm was swollen a lot, twice as large as his left forearm. However, like I said, after his first treatment, it was already reduced by 50%. So chiropractors do treat carpal tunnel. Not all of them do. Not all are as knowledgeable. So you want to just be sure you go to one that has lots of experience with carpal tunnel. Thank you.
Thanks, Joe. That was incredible. The stories that we hear every day and every time we get together as a group about carpal tunnel syndrome. You know, a lot of people have such a varying amount of health issues, and sometimes they don't even look at a chiropractor as being able to solve the problem. But they go from doctor to doctor to doctor, from this test to that test, from this therapy to that therapy, before they finally will come and say, this is the last resort, so I'm going to try it. Dr. Randy Fick from Cincinnati, Ohio, has an interesting story that kind of exemplifies a condition that most people don't look to chiropractor for, but listen for yourself and you'll get the results.
Hi, I'm Dr. Randall Fick in Cincinnati, Ohio, and today we want to talk about plantar fasciitis. Our office has 6 shock waves, also known as extracorporeal pulse activation therapy, and we have seen a tremendous success with this type of technology for plantar fasciitis and also Achilles tendonitis and heel spurs. And the way our protocol works is that we actually apply the shock wave to the area where there is a heel spur or plantar fasciitis, and we also work around the Achilles tendon. Now, one important thing you can't forget is that there is a nerve innervation to that area, and that is called a sclerotome. And the sclerotome to the heel is usually right around L5S1 or in the lower back. So if you apply appropriate therapy, stretching, rehab to the origination of that nerve, then you'll often get a much better result. In fact, our results are so fantastic that every time we treat somebody, they just start getting better right off the bat. So that is a very tough condition to treat, very difficult to heal with surgery, and certainly requires somebody thinking a little bit outside the box to incorporate all the body healing processes that are possible. So we certainly use shockwave or EPAT, EPAT, extracorporeal pulse activation therapy, to help with Achilles tendonitis, plantar fasciitis, and heel spurs. Thank you.
Wonderful story, and I'm really, and I've said this before, but I hear these things all the time, and they still, after all these years, and I grew up in chiropractic, but all these years it just amazes me of what doctors are able to do and what we do in our clinics every day, and it's just a wonderful experience being able to get together with this group of doctors that we do, and it's such a positive experience for all of us because we just talk about all the good stuff that's going on, the good stuff that we're doing in our offices and with our patients and how people are getting better. And that really is the doctors that are on our program today. That's their focus every day in their offices, is just to help all of us to keep ourselves motivated, but help all of you, our patients, to get the better results with health. I'm going to bring back Dr. Bruce Holmes from Burbank, California. And Dr. Holmes has a really incredible story about a speech problem. And this is, again, another problem that we don't look at as a typical chiropractic case. But when you hear what Dr. Holmes has to say about it, you'll understand why it should be.
Good afternoon. My name is Dr. Bruce Holmes. I'm from Burbank, California. What I would like to discuss is the interesting process of treating patients that have speech disorders. We've treated a number of people that have problems with stuttering, stammering, and other types of speech disorders, but probably the most gratifying story and case history has to do with a boy whose name was Austin. And to make a long story short, Austin came in with his parents who were being treated for injuries sustained in an accident, and Austin was approximately 5 years old and unable to talk. And the parents introduced the other two boys, and they shook my hand and told me their name, but Austin shook my hand and was unable to talk, and I asked his mom if he had a problem with his speech, and she very defensively said that she had or that Austin had never spoken a word in his life, and he was 5 years old and in the process of being scheduled to go to a school for the deaf so he could learn sign language. And so I asked if I might be able to evaluate him because I'd had success in treating other people with speech disorders, and she was very defensive and said that he had been treated by the best doctors at UCLA for 3 years since the age of 2, and nobody had succeeded in getting him to say a single word. So the husband was a little bit more pragmatic, and he asked if the evaluation could possibly hurt Austin, and I assured him that it couldn't. And upon evaluating him, I found that he had problems in the upper part of his neck with the nerves that normally control the vocal cords. And in the process of evaluating him, we took x-rays and found that there was a malfunction in the upper part of his neck. And after about 3 weeks of treatment, Austin started to talk for the first time in his life. And after about 3 months, he was talking almost as well as his younger and older brother. The interesting part was his mother's treatment continued for several months. We started treatment on Austin in probably February or March of the year. He was scheduled to go to the school for the deaf in September, but rather than that, he enrolled into regular kindergarten. And at Thanksgiving of that year, his mother was having treatment, and she motioned to Austin to come over to where I was treating her. And in the process of reciting what he had done that day, all in really well-spoken English, he also said that he had memorized a whole chapter out of the Bible and proceeded to recite it to me. That was a rather emotional moment, probably nothing much better than hearing a kid talk that was not ever expected to talk in his life. So chiropractic works very well for treating people with speech disorders when that problem is induced by problems that of the nerves that affect the vocal cords or the tongue or the throat.
Terrific story. back in the beginning of the program, we had talked about the pinched nerves and the lower tissue resistance with the dysfunction and the symptoms, severe symptoms, disease, and degeneration. One of the things that we have always found to be very, very beneficial is finding the condition the earlier in its progression as we can to get it corrected. It's easier, faster, and less costly if we find a problem early and fix it rather than wait till it becomes long-standing and or chronic. Dr. Darcy Stotts from San Angelo, Texas is going to talk to us about a condition that she saw with a young child in her office. And the reason I asked her to do this, and the reason I am including this on our program, is because we all treat kids, but so many people don't know that we do it. I remember I have a family of children that come in on a regular basis. They're maintenance. There's no real health issues or no significant health issues. They're on a maintenance program for the kids to keep them healthy. Grandma and grandpa say these kids are going to do it, and they pay for it, and mom brings them in every week. Now, the important thing with the kids is, if the kids are kids, they're going to fall, they're going to trip, they're going to bounce, they're going to get into hit in the head by swing sets, or they're going to fall off slides. They come in, we find the problems, fix them, and they go on. They don't get sick very often. So treating kids is crucial. But so many people don't know we did it. And this lady that I had in when the kids were in about 3-4 weeks ago, she said, "Oh, I didn't know you treated kids." Now, we have posters up in the office. We have inside our front door, we have a brochure rack that tells people all different things. It talks about children. But, people don't read them. So we're going to try to talk to them this way. So here's Dr. Darcy Stotts going to talk about a really great case she had with a child. You were telling me you had this patient, a child in your office, that you would consider that pretty much a miracle.
Yes, I would.
And do I understand that it even got written in the newspaper?
Yes, it did. Okay.
Well, why don't you take the microphone here and tell everybody about your story.
Thank you, Dr. Jim. This story is a really important story for my staff and my clinic family, and really anybody to share about chiropractic. We met a young little guy. He was a 4-day-old newborn by the time we saw him. He was referred to us from his grandmother. He had been born on a Monday. Everything looked great, but that afternoon he wasn't really nursing. And the doctor said, he'd figure it out. Next day he wasn't nursing, and that was still pretty early, so the hospital didn't worry about it too much. By Thursday, the family was very distraught, and the mother was completely a wreck over the whole thing, and he had not eaten anything. He had an eyedropper that they were using to feed him milk with, but he had not learned to latch on and nurse. The hospital said that was very normal, even though he had lost over a pound, and he was only about 6 pounds when he was born, so he's pretty tiny. And the grandmother referred young Kiernan to our office. Kiernan was brought in, of course. By this time he was completely lethargic, past the crying point, didn't cry, didn't wiggle, didn't move. And we were pretty concerned. We took a full spinal exam and checked his upper cervical spine and found that his atlas was misaligned. And that was impinging nerves at the brainstem, at the jaw joint, facial nerves, the hypoglossal nerve, cranial nerves to his face and to his mouth and his tongue and his hard palate and soft palate. And we found that after we provided a very soft chiropractic adjustment with an instrument, computer-assisted instrument, Kiernan was able to start moving his face and his lips, and he latched on about 2 hours later to nurse. And within about 24 hours, he'd gained about 11 ounces. And so that was an amazing thing. So we checked him Friday, and then we checked him again on Saturday. He needed another adjustment. And what became a very crucial point in his life actually turned around his entire health, and he became one of our favorite patients, and he got adjusted every week after that. And he needed that for about another 4 or 6 weeks. And now Kieran today is a happy 3-year-old normal kiddo, runs and plays, and he's super healthy, fortunately, because of chiropractic.
Thank you, Darcy. I want to extend a special thank you to all of our doctors who have participated in our program. As I said in the earlier, at the beginning, these are some of the most elite chiropractors in the United States. These doctors that are a part of this group and that have participated in our program today are on a very high level of consciousness on patient health and improving patient health. And so if you happen to see your doctor on the program, talk about these conditions to your family and your friends and your neighbors and bring them in with you. Even if they not ready to talk to the doctor, bring them in and let them see what happens in a modern chiropractic office where the focus is completely patient-based. Moving on to our very last interview of the day, of the program. This kind of relates to children, but also in injuries. This lady, her name is Isla Kelton, and she's going to tell you a story about an accident she had when she was 16 years old that left her with facial paralysis. Now, Isla is a lifelong chiropractic patient, and I think that you'll really enjoy the story. We have a really interesting story. Now, we're going to deviate from our theme a little bit here in this last segment, but we have a lady that I've known since I was 10 years old, and she has an interesting story about Bell's palsy. So I'd like to introduce Miss Isla Kelton. Now, Isla, you had a trauma, and I'm going to let you just kind of tell the story from the beginning here, because I've heard about this story since I was 10, but I didn't necessarily remember all the details. So tell us a little bit about what happened and the symptoms and what course you've taken to get it to where it is today.
Thank you. Yes, when I was 16, my horse and I were jumping fences, and we both landed on our heads, and that resulted in a spinal injury. And after that, I had horrible migraine headaches. And then a few years later, I was married, working an accounting position in a big company, had a husband and a small son, and I got Bell's palsy. The left side of my face became completely paralyzed. And I'm sure you've seen people with Bell's palsy. You might not have recognized what it was, but your eye droops, your mouth droops, you drool. It's really horrible. And I was suffering from it for about a year and had gone through a number of types of doctors and treatments, and nothing was helping. And a neighbor of mine suggested that I go with her to her chiropractor. So I did, and after examination and x-rays, he said, well, you've had a spine to your you've had an injury to your spine. And I said, yes, I did, but no one else had ever connected that injury to my facial paralysis. And he said, well, I don't know if we can help you, but I'm willing to try, but I can tell you it's not going to be easy, and it's not going to be of short duration. And I said, you know, I can't live, I don't want to live with this kind of facial paralysis the rest of my life. I'm willing to do whatever it takes to improve. So I started going to him every evening, 5 evenings a week after work. And this went on for about 3 months. And I was getting very disappointed in it. And he said, I think we're making progress. And we did. We did. I could begin to feel a change in my facial expression and the way I was feeling. And so we moved it up to three times a week. And I went for another 6 months, and it was becoming much better. And so then we finally got to where I was going once a week, and I continued to do that for 3 or 4 years. In fact, finally the doctor said, well, you're coming here so often, why don't you just go to work for me, and then you won't have to spend all your paycheck on treatments. And I did. And so I have had chiropractic care for some close to 50 years. And I have had thousands of treatments, but I have not had one too many. And I know that chiropractic has kept me healthy. I will soon be 83 years old, and I've never been in a hospital except when I had my son. And I take no medications, and I'm really, really healthy, and I thank chiropractic for it every day.
Thank you. Do you still continue to get treated regularly, is that correct?
Oh, I do, yes.
How long can you go without an adjustment before you start seeing a change to your Bell's palsy?
Well, it depends on what I'm doing, but one of the things that is very strenuous for me is riding in a car for any length of time, say an hour or more. So I know if I'm doing physical activity, or I'm riding in a car, or there are a few other things that I can begin to feel the muscles in my face sag, and I know I need to get back to the chiropractor. And it's never more than a couple of weeks between treatments, and lots of times I'm in the office 2 or 3 times a week.
And one of the reasons that I asked Isla to talk about this case is because of the chronicity and the significant injury that she sustained. And there are a lot of times we see patients in that situation all the time, but I would consider your story to be a miracle.
So would I. Thank you.
Thank you, Isla. Thank you, Isla, for sharing your story, and we really do appreciate it. As I said earlier, I know I've known Isla for most of my life, and she's a real inspiration to me and my family. Somebody who is at her age and on absolutely no medication. I could just imagine if she ever had to tell somebody in the emergency room, or that she had taking no drugs, they almost wouldn't believe her. But it's a real interesting story, and we really appreciate her sharing that story with us. I want to thank all of our doctors for participating in our program today. We really do appreciate the time they take out to participate. And we want to thank all of you for your attention over this program, and hope that you've learned something that will help you to better understand the treatment that you're under with your chiropractor, but also to be able to be an ambassador, go out there and talk to your family and your friends and your neighbors who have conditions that aren't getting better, conditions that you think maybe that we can help in our offices. I'm Dr. James Bissland.